Oh, you have read for more than 3 hours, you have read for more than 5 hours, and you still don't understand. Don't worry, in this video, I'm going to break down easiest ways for you to understand after reading each course in nursing. So many students they make this mistake that each time they tend to forget things in exam hall, or maybe if they are revising, they don't used to remember some things that they have read about long ago. So I'm going to break things down. So the first mistake that students used to make is that they do passive reading, because when you read, you are supposed to ask questions, like make imaginations. Why is this kind of thing happening? For example, let's take for example tuberculosis, for instance. When you are reading about tuberculosis, after reading, you imagine it in your head, and then you begin to think, why is this? What happens if this thing occurs in my body? What signs and symptoms is it presenting in my body? So many students tend to do this passive reading, which makes them fail. Because if you do passive reading, there is no how that you can pass. So you have to stop passive reading. When you are reading, you have to ask questions. Each one that seems confusing to you, please ask questions. Then the second point to make reading easier is to break things down, jot things down on a paper. As you are reading, please get a jotter, because you are not James Bond, please. As you are reading, your brain cannot assimilate everything that you have been reading for more than 4 or 3 hours. Please get a book, then jot down the important things. For instance, when talking about hypertension, you already know that it means that simply that the blood is pushing too hard against the wall vessels. That's it. So the third point when you are reading to make things easier is use real life scenario, real life imaginations. For example, if you are a nursing student, you have been to the clinicals for your experience. You can use imaginations of patients who have the same signs and symptoms. For example, tuberculosis or any upper respiratory tract infection. For example, if you're reading about any infections concerning the lungs, the bronchi, anything related to respiration, you can relate it to the experience that you have seen in the world, to make things easier, because our brain tends to record things much faster when we imagine things. So when you're reading about tuberculosis, if you have taken care of a tuberculosis patient, you can relate it to that. So the fourth point here is that you have to read small. Please don't overstress your brain. You don't have to copy others, because your friend is reading for 9 hours straight up, or your friend is reading for is doing till daybreak. So you want to copy that your friend, because you want to be exactly the way that your friend is. Please, your brain capacity and that of that your friend, they are not the same. Please don't copy. If you know how your brain assimilates things, please do it like that. Read small, then you revise more, because each time you revise,